Thank you so much for the opportunity to come to Boston here. We appreciate the invite. Thanks to NDA as well as Michelle for coordinating the invite. So my name is Paul Mehta, and we'll be talking about the National ALS Registry and how you can join the fight against ALS. I've got no disclosures. And brief outline of the presentation, I'll be talking about how you can join the fight against ALS, the importance of the National ALS Registry and why you should join, as well as the National ALS Biorepository, what it is, and why it's important, as well as how you can join, and how you can join clinical trials that we help to recruit for, as well as take the risk factor surveys we have in the National ALS Registry. We'll also be talking about what's the registry doing to find the causes and risk factors for ALS. We fund research. We do a lot of publication of research as well. We also look at who gets ALS in the US. And then I got a couple videos at the end which are informational, and one's a patient video as well. And then any questions you may have. So we like to say we do a lot more than just count ALS cases. The National ALS Registry, or registries in general, typically do case ascertainment. That is, they'll go ahead and look at a specific disease and do the number of cases in the US. ALS is unique, and because it's unique, we've actually expanded our scope within the actual mandate we have from Congress. And so the National ALS Registry has the National ALS Biorepository, which I'll be talking about. We look at the epidemiology of ALS, the incidence, the prevalence, the mortality. We work with partner organizations such as MDA, which is one of our strongest partners. We also have survey data, which are collected by patients who take our risk factor surveys. We also have our research notification system, which allows patients to receive information from us regarding upcoming clinical trials and so forth. We also fund research. We know research is very, very important to figure out the mysteries behind ALS, and so we actually fund quite a bit of research. And lastly, ALS research counts on you. This is your registry. I'm a caretaker of this registry, so we want to make sure that you are involved in the registry. So why is the National ALS Registry important, and why should I join? There are more unknowns and knowns about ALS. Gehrig was diagnosed almost 75 years ago, or over 75 years ago, and progress has been made, but more progress is needed, obviously. And so the goals of the National ALS Registry are several. We look to find out what causes ALS, the etiology of ALS. We look at the risk factors of ALS, environmental, genetics, occupation. There was a recent question which came up in one of the previous speakers about military veterans and why they get ALS at twice the rate. We're not sure why. Perhaps it's linked to their actual service. We're just not sure yet. As well as we look at the cases of ALS in the US, incidence prevalence. And this registry actually is mandated by Congress. There was a strong pushback in 2008 to go ahead and have a registry for ALS specifically. So keep in mind, Parkinson's, Alzheimer's, they have no registry. So ALS is unique that they have their own registry. And this registry is voluntary. But like I said, ALS registry counts on you, and this is your registry. So one of the questions we're always asked is, how many cases of ALS are there in the United States? So in the area of public health, there's something called reportable and non-reportable diseases. So reportable diseases are diseases or conditions which are reported back to CDC through the through the state level. So for example, communicable diseases like tuberculosis, HIV, the flu, those are reported back to CDC, and we'll go ahead and have a pretty accurate number as in terms of what the case counts are. Obviously, it will never be 100% because you're always missing cases. But ALS is unique because it's not reportable except in this state. So Massachusetts is the only state in the union where actually physicians are required to report ALS diagnoses to the state, and the state collects this data as well. We met with the state yesterday because we're working on a project with them to go ahead and look at our data and their data and compare to see if cases are missing and so forth. So we're going to be doing a project with your state health department for that specific purpose to determine the completeness of our data and your data. And so ALS, so like I mentioned, right now what we have is we cannot collect cases from private insurance companies, those who get their care, let's say from a Blue Cross Blue Shield or from an HMO. That's limited at this time because these insurance companies, they don't want to give us their PII, which means personal identifiable information like the names and so forth of the people they're taking care of. But we feel that we're probably capturing between 80 and 85% of all ALS cases in the U.S., and the bulk of our cases come from the VA system as well as Medicare. So we'll go ahead and we work with these two groups to go ahead and get their cases, and we'll go ahead and absorb these cases into the registry as well. The other way we get the cases are actually through the online portal, where patients will come in, answer a series of questions, and go ahead and join the registry. But bottom line, we can all agree one case of ALS is one too many. So regarding the cases, so we feel there's almost 17,000 cases in 2015 of ALS, and we're probably missing between 4,000 to 5,000 cases which are coming from the private sector, which I just mentioned. This equates to 5.2 cases of ALS per 100,000, which is a slight increase from 5.0 in 2014. Now you're asking, Paul, you're sitting up here, we're in 2019, how come you're telling me about 2015? So what happens is a lot of the data are still fluid. So this information is being collected by Medicare, by the VA, and it takes some time to go ahead and collate and process all these data. And so it's about 2 or 3 years in arrears for us to go ahead and get these data. And so once we get the data, we'll go ahead and do our analyses and go ahead and publish on the actual case counts. We are currently working on 2016, and we hope to go ahead and have that published this fall. We also have the risk factor surveys in the registry. So if you join the registry, you have several options to join research. One of them is the National ALS Biorepository, which I'll go over, as well as getting information about clinical trials and so forth. But the risk factors are really, really important. A lot of questions were asked today about sporadic ALS or SALS and FALS, familial ALS, which covers about 10%, and then 90% is the rest for sporadic ALS. Our focus typically is ALS in general, but we typically focus more on the sporadic side. So the risk factor surveys we have, we look at occupation. Are there certain occupations out there which are at a higher risk of getting ALS? The military, we know our veterans are at greater risk of getting ALS, we're just not sure why. Physical activity, smoking, drinking, are these risk factors? Where have you lived? Were you living close to, let's say, for example, a smelter or a Superfund site? So we want to look at that data and see if there's a connection between living close to somewhere, which is potentially you're exposed to something throughout the years, and as a risk factor for ALS. We also have something called disease progression, so which allows us to have patients answer these questions. It's a ALS FRS survey. We also have an open-ended survey, which allows patients to tell us what they feel may have caused their disease. But overall, all these surveys help us to figure out the mysteries behind ALS. So we have these 17 risk factor surveys right here, and these can be taken in any order, and there's no reason to take them all at once. Like I said, I mean, you can take them at your leisure. And these risk factor surveys are very, very important. Like I mentioned, there's demographics, occupational history, physical activity. There was a comment that was made by, I believe, by Dr. Berry and Dr. Brown about physical activity, how vigorous physical activity in certain athletes could be prone to getting ALS. There was some research that was done by the Italians, which showed soccer players, for whatever reason, potentially maybe using their head too much when they go ahead and hit the ball with their head, could be a potential risk factor for ALS, and so forth. But we have all these risk factor surveys that help us go ahead and solve the mysteries behind ALS. So as of this past week, we have over 83,000 completed surveys, and we're in the process of looking these over and publishing these results. And so we also have the biorepository. Well, this biorepository is part of the registry, and it's unique in several different ways. We work with researchers to, for example, to look at the areas of genetics, identification of genes. So genes were a big topic this morning, so we actually genotype all our patients, whether they have SOD1, C9, or some other gene. We also work with biomarker identification. It was mentioned there is no blood test for ALS, and hopefully that will change in the future. And so by looking at these biomarkers, we can look at disease progression. We can look at if certain drugs will work or won't work. And like I mentioned, we can hopefully have a blood test for ALS, which would be simple and cost-effective to say, yes, this person most likely has ALS. We also look at stuff like heavy metals. So, for example, with all the patient's specimens coming in, we look at lead, arsenic, and so forth. We look at something called persistent organic pollutants in our samples. So these are pesticides, insecticides, and so forth. So this National ALS Biorepository, like I said, is very unique. when patients join, they'll go ahead and click and say, I want information about the biorepository. We will mail you a packet in about 2 weeks saying, information about the biorepository. This is completely free for patients and caregivers. Like I said, this is your biorepository, this is your registry. And what we do is we go ahead and link the risk factor surveys, which I mentioned before, to all the patient samples, so we have a rich data source right there. And it's also nationally representative, meaning to say these samples are coming from across the country, not just from just one certain location. It's user-friendly, like I mentioned, so we'll coordinate with our team with you to have a phlebotomist come to your house to go ahead and collect your blood, urine, saliva. And we also have a postmortem collection too, which I'll mention briefly too. But this biorepository, like I said, is also unique in the fact that these are pristine samples for researchers, not leftover samples from a previous study. So our goals for 2019 are to collect 325 bloods, 125 salivas, and 10 postmortems. We're actually pretty far along in collecting our bloods and salivas. But bottom line, this biorepository in 3 to 5 years will be the largest collection of pristine ALS samples in the world for research. This right here is an overview of the biorepository where we have the in-home collections, the blood, urine, saliva, as well as the postmortem collections, and how they're married together. And the specimens go out for research, and then we have the surveys which are linked to the actual specimens themselves. Now, switching topics to clinical trials and epidemiological studies, we know clinical trials is really, really important to join clinical trials and so forth. So what we do is we actually partner with pharmaceutical companies to work with their upcoming clinical trials. So when a patient comes in, they'll go ahead and select, yes, I want information about a clinical trial, and they'll click the box, and every so often, probably 2 or 3 times a month, we'll go ahead and send them a quick email simply saying, hey, there's a clinical trial, name of the study, and so forth, and they can go ahead and contact the actual company itself. So we've actually helped to recruit for over a dozen clinical trials so far, and Dr. Berry, one of them we actually was Brainstorm, which was mentioned, as well as for Dr. Skovic, Orion, and Dr. Paganoni as well. These are all MGH individuals up here, so certainly MGH has become a hub for a lot of these clinical trials. And so these are just a small list, a small sampling of the clinical trials that we've helped to recruit for. We also do epidemiological studies as well. So for example, a particular survey, if a researcher wants to look at microbiome, Dr. Catherine Nicholson, who's also part of MGH, had a survey on gut microbiome, which is a gut flora or bacteria in everyone's guts. And so these particular surveys, like I said, we partner, we collaborate with industry as well as academia to go ahead and work with them to help them progress their research along. And the registry also funds a lot of research. I mean, research, like I said, is very, very important. We are a research institution. We're a research hub. And so to date, we have 16 research studies that we've actually funded. And so, and this information is helping us learn more about risk factors. What is for example, heavy metals a risk factor for ALS? And we know certain heavy metals potentially are a risk factor for ALS, and so forth. These are the areas of research we've actually funded so far. Like I mentioned, a question came up about cyanobacteria, which is a toxin, and that was which is found in bodies of water, and so that actually is being funded through Dr. Elijah Stommel over in Dartmouth, just up the road right here, and he's looking at cyanobacteria, and is it a potential risk factor for ALS? We work with looking at pesticides and pollutants, air pollution, looking at biomarkers and genes. We're also looking at the role of hyperlipidemia, which is increased cholesterol in your body, and fats, and diabetes, as well as autoimmune diseases and how they interact, or if they're a protective factor for ALS. We're also looking at the genetics of ALS as well, like I mentioned earlier, as well as oxidative stress. Our body generates free radicals throughout your life, and are these free radicals potentially, a mitigator for getting ALS? So that's it right now. Well, I'm going to go to the videos right now. So we have 2 videos I want to show you. This one is a informational video about the registry.
ALS research counts on you. For progress in ALS research, we need your help. You can help by sharing your data with the National ALS Registry. The National ALS Registry is the only research project of its kind. Data from the registry will be used to help us better understand risk factors for ALS. If more people with ALS join the registry, we can add to that knowledge. We are gathering information to help us learn what may cause ALS. Your data will be used to identify people in the U.S. with ALS, learn more about the characteristics of those with ALS, and better understand risk factors for ALS. How can you make a difference? You can take part by safely and securely sharing your information and taking the risk factor surveys. Finding out what may increase the risk of getting ALS could help guide research into the treatment and prevention of ALS. Patients can also use the registry to connect to other research studies and clinical trials. Turn ALS research into ALS progress. Learning more about people with ALS is critical to defeating it. Learn more about the National ALS Registry. Visit cdc.gov/ALS for more information.
I've got one more video. This is a patient video, and it's a pretty powerful video. And this gentleman right here, his name is Ed Tesoro. He actually is a, he's a patient who is, we know him very, very well. He's based out of Atlanta, Georgia, and he goes to the MDA clinic there in Atlanta. I believe it's the MDA ALS Association joint clinic.
The ALS Registry, to me, is a great way for all of us to bring whatever our data is and whatever our personal experience is, even though it's just data. But to have that go into the registry and allow the scientists to analyze what it is that we are all about, how our disease is progressing, how long we've had it, what biomarkers we might have. All of that is steps towards a goal.
The first step is finding the cause through the disease registry. Research is the key because there's so much we don't know.
I think it's essential that we get as many people in the registry as possible. I just assumed I was in the registry. I don't know why, because I just got all this paperwork and all this stuff. The more we know, the more the researchers will have to get to an answer, and we've got to get to an answer. We have to.
The least that every patient can do is to get online and sign up for the registry.
No one seems to know the whys, and I feel like if we could find out the whys, you know, there's more to the research, I think, than just the test tubes. I think it's a very, very cruel disease. I have to have hope.
Thank you. And I'll take your questions. Great. Yes, ma'am. I think the fact that back in 2008, patients were calling for more ALS research, and this was spurred upon by one of the other partner organizations called the ALS Association, and they actually pushed the registry to members of Congress. They wanted their own registry to go ahead and look at the risk factors of ALS. At that time, no one really knew how many cases of ALS were in the U.S., and so there was a big impetus to go ahead and have members of Congress go ahead and have their own registry. And so they they actually passed the ALS Registry Act by itself back in 2008. So this occurred like around 2005, 2006, and it finally came to fruition back in 2008 when the president signed the ALS Act that we launched 2 years later in 2010. But bottom line, it was a way for patients to go ahead and get more information about ALS, expand the ALS research portfolio, looking at risk factors, working with pharmaceutical companies, and just finding out more about the disease itself. So, yes, sir.
That's, precious, how are you vetting people that want access to it or to use, those tissues and samples?
Great, that's a great question. So we receive applications through an application system on our website for researchers only. So they submit to us what the purpose of the actual of their study is, RB approvals. It goes to a committee which reviews this information itself. It's only for ALS research. Our samples are precious, and we don't want to give our samples out for anything which is not ALS. So everything is vetted to make sure it is scientifically meritorious when it comes to getting these samples out for researchers. To date, we have currently eight groups we've given samples to go ahead and look on, like I mentioned, whether it's genetics, pesticides, heavy metals, and so forth of ALS. Yes, ma'am.
Are there similar registries in other countries, and if so, what kind of cooperations do you have with them?
So there are other registries in other countries. So Ireland has their own registry, and some of the other countries have their own registry as well. Our system is somewhat fragmented in this country when it comes to healthcare, and so they do a better job knowing who's got the number of ALS cases, let's say in Ireland, which is a smaller country, obviously, and other parts of the world. But there are other registries out there. We actually work with the chief principal investigator of the Irish registry. Her name is Orla Hardiman, and we actually fund her, and she's looking at ALS risk factors in the population, comparing the European population to the population in South America, namely Cuba, Chile, and Uruguay, and seeing why does that population in South America get ALS at a lower rate than the population in Europe. So we do work with them. We don't really share too much data because the National ALS Registry is only for U.S. citizen and legal residents, and so you can live overseas, and let's say, for example, you're on a base and you're a U.S. citizen, you can always register that way, or if you're living overseas, that is. So we do work with other collaborators internationally, but data sharing can be a little bit difficult because we could look at our data and their data, for example, whether it's, let's say, demographics, sex, age, of who's getting ALS and so forth, but we can't do any sort of data melding at this point. Yes, ma'am.
Hi, I have two questions. One, I wasn't aware that Massachusetts had become a mandatory reporting state. Yay, us. But is that reporting to the National Registry, or is that a separate state registry?
So your registry came about, I believe, by your governor, Paul Cellucci, who was diagnosed with ALS, and so I believe there was an impetus by your state legislatures to go ahead and have their own registry. So that data are collected by your state. It's not reported to us. That could change in the future, something like that, but currently data are housed here. I mentioned earlier, we currently are working with your state to go ahead and do a project to compare our data and your data to see exactly the completeness of the registry versus your registry here. So we're working with them to do a data analysis on that. So, but at this point, there is no requirement for them to go ahead and send data to us at this point. A lot of it has to do with the fact that, a lot of the health departments in the country, sometimes, they don't have the resources available to go ahead and transmit data to us and so forth. So for something which is communicable, whether it's flu or HIV or tuberculosis, that's a little bit different because it's passed on by person to person. But even like with Alzheimer's or even with Parkinson's, those are not reported to CDC. The only exception would be the cancer registries. They've been around for a long time, and they do have a better reporting requirements. This registry is only 9 years old, so it's still it's progressing, it's maturing.
Okay, so that kind of leads to my second question, I think, which is, since there's mandatory, it's automatically capturing veterans' data and automatically capturing Medicare data, but there's this other piece of people that don't fit into that voluntarily should report. And are you doing any efforts, particularly in other parts of the country, I'm thinking, where you are trying to reach out to primary care physicians, which is often where people will go when they don't live near a big research hospital? They'll go to their primary care physician. It'll take a while, and that's who will diagnose them. They may not have the support of MDA or don't know that they should be, to get those people to try to voluntarily report. I know you've come to AveXis in Washington, but I'm just thinking like additionally trying to push out to where people aren't gathering and being collected.
No, you're absolutely right. There are parts of the country, in the rural states and the mountain states, where people are not going to multidisciplinary centers for their care. They're being seen by their local neurologist or maybe their local primary care physician. And we work with partner organizations such as MDA and the ALS Association to reach these particular areas through their own chapters and clinics as well, to educate and inform them about the registry. States like California, which are very diverse, Texas, we're working with these guys much more closely to make sure we can inform them about the registry and have them join the registry as well. But let me just, case counts are certainly important, but for us, I think, the research out there when it comes to supporting research, funding research, able to, fund institutions of academia where they can go ahead and look at the risk factors for ALS certainly is very, very important as well. But we're a very small group, but we do work with, like I said, the MDA is one of our major partners to go ahead and spread the word to these groups as well. We also, for example, do journal articles, or we also do advertisements in magazines, journal magazines, which are geared for physicians as well, to let them know about the registry. Yes, ma'am.
Yeah, you talk about risk factor surveys.
Mm-hmm.
And you talk about groups of researchers looking at the data. Do the results come back to the people who are in the registry so they
Absolutely.
they're published online?
Absolutely, and actually, I didn't mention that, but we actually have published over 60 journal articles since inception, and the majority of these journal articles are open access, meaning to say, in the area of academia or journals, a lot of the times they have a firewall where you have to pay a certain amount of money to go ahead and read a journal. We actually will go ahead and pay the journal upwards of $3,000 to make that article open access, so it's available for researchers to read. Available for patients and their caregivers to read, which we feel is very, very important. After all, this is their information. We want to make sure they get this information about the registry, as well as what we're publishing, whether it's risk factor surveys and so forth. Yes, we actually have on our website, cdc.gov/ALS, there's a link called Publications, where you can see all our publications that we currently have helped to support, or we actually are co-authors on. Yes, ma'am. Oh, yes, sir, sorry.
Is there any relationship or data exchange with the ALS registry and the National Medical Record Board or something like that, and also the insurance company?
So we can get information from insurance companies through de-identified databases like MarketScan and some other ones. But these are de-identified, meaning to say we'll have information about who has as in terms of it's an ALS diagnosis, but we will not get their names. So without their names, we can't match them up with what we currently have in-house. Otherwise you can have overinflation of case counts. And so a lot of these systems they have in place, whether it's MarketScan, which is a big one, or Optum, which is United Healthcare, they don't want to release to us or to really anybody their patient information. I think a lot of it has to do with HIPAA as well as privacy concerns as well. Sir, any more questions? Thank you so much. Thank you.